Assalamu alaikum. My name is Nur Sahar and I'm discussing about genetic disorder. As all of you are familiar that there are 46 chromosomes in every cell of the body, but one pair is different between boys and girls, the sex chromosomes X and Y. Now, a genetic disorder is a health problem caused by one or more abnormalities in the genome. It can be caused by a mutation in a single gene and multiple genes, or by chromosomal abnormalities. Around 1 in 50 people are affected by the single gene disorder, and around 1 in 263 are affected by a chromosomal disorder. There are over 6,000 known genetic disorders. Now we're discussing about the type of genetic disorder. There are three types of genetic disorder: single gene disorder, multifactorial disorder, and chromosomal disorder. The first type of genetic disorder is a single gene disorder, which is also called monogenetic disorder, a genetic disease caused by a small-scale genetic differences that cause the malfunction of a single gene, which is further divided into autosomal disorder, allosomal disorder, and mitochondrial disorder. Now, this slide is about autosomal disorder or non-sex chromosomal disorder, which is further divided into autosomal dominant and autosomal recessive. Only one mutated copy of the gene will be necessary for a person to be affected in autosomal dominant, while two copies of the genes must be mutated for a person to be affected in autosomal recessive. In autosomal dominant, usually one parent is affected and the chance of the child will inherit the mutated gene is 50%. In autosomal dominant, while autosomal recessive usually has unaffected parent and chance of a child will inherit the mutated gene is 25%. Now, as you can see, I divided this slide into two sections. One is autosomal dominant and the other one is autosomal recessive. I write few diseases about autosomal dominant and a few diseases about autosomal recessive. In autosomal dominant, I describe about Huntington disease, which is neurodegenerative disease, neurofibromatosis type 1, which is pigmentation and multiple non-cancerous tumor of nerves and skin. Neurofibromatosis type 2, non-cancerous tumors, growth in the nervous system, and so on. And autosomal recessive, I describe albinism, in which people are born without the usual pigment colors in their bodies. Cystic fibrosis affects the lungs and digestive system by clogging. Sickle cell anemia disease, which is abnormality in the oxygen-carrying protein, hemoglobin found in red blood cells, and so on. Now, the allosomal disorder or sex chromosomal disorder, which have a significant role in sex determination. X-linked dominant disorder are caused by mutation in genes on X chromosome. Male and female are both affected in these disorder, with male typically being more severely affected than female. If male is affected and female is unaffected, then all daughters are affected while sons are unaffected because male donate Y chromosome to the son. However, if male is unaffected and female is affected, then 50% of sons and 50% of daughters are affected. It includes Rett syndrome, Archdale syndrome, Klinefelter syndrome. Rett syndrome are rare neurological disorder that happens mostly in young girls and cause impairment in abilities to talk, walk, eat, and even breathe. There is repetitive hand movement, including flapping and clasping hands. Next is Archdale syndrome, characterized by partial or complete absence of key structure of brain, called corpus callosum. The presence of eye abnormalities and infantile spasm. Symptoms are normally seen in females between the age of 2 and 6 months old. Both Rett and Archdale syndromes are fatal in male and therefore seen in female. Klinefelter syndrome affects male only, which was identified by Dr. Harry. And in this syndrome, there is an extra X chromosomes or sometimes more, which generates less testosterone, which involve in development of sex organ, height, and body shape. There no gender identity in male. X-linked recessive disorder are also caused by mutation in genes on X chromosome. Male are much more frequently affected than female. The son of a man with an X-linked recessive disorder will not be affected, but his daughter will be a carrier of one copy of the mutated gene. Carrier woman has a 50% chances of having son who are affected and 50% chances of having daughter who are carrier of one copy of mutated gene. It includes hemophilia, which is a genetic deficiency in clotting factor 8, which increase bleeding and usually affect males. Lesch-Nyhan syndrome, a rare genetic condition, leads to excess uric acid in blood and cause gout, kidney, and brain problems. Now, the Turner syndrome, boys having 46XY, while girls have 46-2X chromosomes. But in girls with Turner syndrome, the second X chromosome is missing. Because of this, their body develops slightly differently. Therefore, shorter height and ovary don't work properly and produce less estrogen and progesterone. Subtle physical differences include wide neck, slightly puffy hand and feet. Turner syndrome usually diagnosed after birth, and because the main feature only occurs at puberty, some girls aren't diagnosed until they become teens. Life expectancy is reduced by up to 13 years. Y-linked are caused by mutation on Y chromosomes and only be passed from men to their son. Female can never be affected because they do not possess Y allosome. It includes apotrichosis or overgrowth of hair of the ear, webbed toes, and porcupine man, conditions when skin thickness and gradually become darker than with bristle-like outgrowth. Now, as you can see in this slide, I put a chart over here which describe different chromosomes have its own individual disease. Mitochondrial disorder is also called as maternal disorder and are rare. Mitochondria is a complex piece of machinery and are the powerhouse of the cell and use a process called oxidative phosphorylation. Only mother can pass mitochondrial disorder to their children. Disease caused by damaged mitochondria can be varied, which means they can affect any organ or tissue and they can appear at different times throughout life. Examples include Leber's hereditary, optic neuropathy, which is a rare genetic disorder. It leads to permanent bilateral blindness. Vision loss may start in one eye, but eventually will affect the other eye. There is currently no cure for this disorder. Multifactorial disorder, which is an interaction between multiple genes and multiple environment factors. It includes asthma, Parkinson's disease, a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. Alzheimer's disease, progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest task. Cellulopathies, cleft palate, diabetes, heart disease, and so on. Chromosomal disorder, which is a missing extra or irregular portion of chromosomal DNA. Error in meiosis can result in chromosomal abnormalities. Variation on 23 pairs of chromosomes number creates or numerical abnormalities called aneuploidy. Aneuploidy result from germ cells having 3 sets of chromosomes is called as trisomy. Trisomy absorbed in 21, 18, and 13 chromosomes. Trisomy of 21 chromosomes is known as Down syndrome, and in the most common trisomy, in which there is an extra copy of chromosome 21, symptoms include flat facial features, small head and ears, short neck, balding tongue, many loops on fingertips, congenital heart disease. Risk of trisomy 21 increase with maternal age. Down syndrome cannot be cured. Early treatment programs can help improve skills including speech, physical, occupational, and educational therapy. With support and treatment, many people with Down syndrome live happy and productive lives. Trisomy of chromosome 18, known as Edwards syndrome, is the second most common trisomy. Symptoms include small jaws and mouth, short neck, malformed ear, overlapping fingers, flexed big toe, prominent heels, back part of the skull is prominent. 80% of infants born with this condition die within a year, with 13% living to 10 years of age. Trisomy of 13, known as Patau syndrome. Symptoms include heart and kidney defects, cleft palate, hollow prosencephaly, many fingers, muscle weakness, intellectual disabilities. The median life expectancy of Patau syndrome is 7 to 10 days, and 90% die in the first year of life. Most genetic disorders are diagnosed at birth or during early childhood. However, some, such as Huntington's disease, can escape detection until the patient is well into adulthood. Diagnoses include predictive genetic testing, pre-symptomatic genetic testing, carrier testing. Prenatal diagnosis can detect the presence of characteristics abnormalities in fetal development through ultrasound or detect the presence of characteristic substances via invasive procedure which involve inserting probes or needles into the uterus, such as amniocentesis. Electroencephalogram is also used as diagnosis. The treatment. Genetic disorder treatment varies depending on the specific disease. Not all genetic disorders directly result in death. However, there are no known cure for genetic disorder. Many genetic disorders affect stages of development, such as Down syndrome, while other result is purely physical symptoms, such as muscular dystrophy. Other disorders, such as Huntington's disease, show no sign until adulthood. During the active time of a genetic disorder, patient mostly rarely or maintaining or slowly the degradation of quality of life and maintain patient autonomy. This include physical therapy, pain management, and may include a selection of alternative medicines programs. Gene therapy show a bright future in treating many genetic disorders. Bone marrow or stem cell transplantation belongs to gene therapy, which is helpful in treating beta thalassemia. The treatment of genetic disorder is an ongoing battle. with over 1,800 gene therapy clinical trials having been completed or ongoing or have been approved worldwide. Despite this, most treatment options revolve around treating the symptoms of the disorders in an attempt to improve patient quality of life. Gene therapy refers to a form of treatment where a healthy gene is introduced to a patient. This should alleviate the defect caused by a faulty gene or slow the progression of the disease. A major obstacle has been the delivery of genes to the appropriate cell, tissues, and organs affected by the disorder. A disease may be rare, but hope should not be. Thank you.